After a breast augmentation performed through an inframammary crease or inframammary fold incision, you can shower after 48 hours. You can exercise in a surgical bra or supportive bra after 1 week. So in other words, I'm telling you, you can work out after 1 week, but you have to wear a supportive bra. And I do not want you doing any upper body exercises for 3 weeks, but you could do some light cardio if you feel up to it and if you're wearing a bra after 1 week. You can go swimming and go underwater after 3 weeks, assuming you're healed and everything looks good. And finally, you can wear whatever bra you want after 2 months. So for the first 8 weeks while you're healing, I want you to wear a supportive bra. It doesn't have to be the surgical bra that I put you in. It can be any bra that supports the weight of the implants while they're healing, that doesn't dig into your incision. My favorite bras are the foam bras. They're essentially like an underwire bra, but there's no wire, it's just foam. They tend to do the best job supporting the implants while they're healing for those first 2 months. I do not like sports bras because they just squash the breasts while they're healing, and we don't want to pancake and crush your breasts while they're healing. So I'm not a big fan of sports bras while healing after a breast augmentation. After 2 months of wearing a supportive bra, day and night, except while you're showering or if you want to cheat, if you're going out to dinner or whatnot, but I want you to wear something supportive most of the time for 2 months. After that, it is totally up to you whether or not you wear a bra. But just try to do your best to support the weight of those implants and support them as they heal in the correct position on your chest. Because what we need to happen is that capsule to form around the implants where we want your implants to sit. If the implants are moving around a lot while you're healing, that capsule or that pocket's going to be larger than the implant. And if the pocket is significantly larger than the implant, your implants have less control when it comes to their position. So when I put the implants in your body, I make a perfect pocket for that implant. Say your implant's like a size 7 foot, I make a size 7 shoe inside for that implant. And we want to support that implant in that perfect pocket while it heals, and it takes about 2 months for that to heal. When I mention capsule, what I mean by that is your body doesn't actually heal to the implant. Instead, your body heals around the implant, and that tissue around the implant is called a capsule. So whenever there's a foreign body in your body will create a capsule around it, and that is totally normal, and that is what is supposed to happen. This is different from capsular contracture, which is when that capsule gets hard. So we want a capsule to form. A capsule will form around your implant, and we want that capsule to be in a very precise location around the implant. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.